Well, new in the debate over the Senate health care fix, some are calling this the doctor fix. Democrats are pushing a bill that would restore $250 billion in Medicare payments to doctors. And some Republicans are upset because, first of all, they worry there's no money to pay for it. And second, because they think this $250 billion ought to actually be factored into the price of the health care overhaul. Joining us this morning is Republican Senator Orrin from Utah, also a member of the Senate Health Committee. Good morning to you, Senator.
Well, good morning.
Senator, is this anything more than a $250 billion accounting trick on the American public?
Well, it's a lot more than that, because that's $250 billion without any offsets at present worth. In other words, that will go way up over the next 10 years to probably almost double that amount of money, and they're not putting it in the budget. So what it means is that the health care bill will, according to the Congressional Budget Committee, the Senate Budget Committee, the health care bill, the Baucus bill, will cost about $1.8 trillion over 10 years, a real 10 years. And you add the 250 to it, it'll be over $2 trillion. I said from the beginning, their bill is going to be over $2 trillion on top of the $2.4 trillion we're already spending on health care. And what's really bad is they said it would be deficit neutral. Well, this is going to be anywhere from $250 billion to $500 billion over the next 10 years. It will not be deficit neutral. And frankly, it just shows that they're playing games with the numbers, and it's awful.
And Senator, of course, there is worry that if you cut Medicare reimbursement payments to doctors, they're going to take fewer Medicare patients. And now we're getting some reports that in meetings with Senate leaders like Senate Leader Harry Reid and others, that doctors groups who met with them were hinted and suggested to them that in exchange for this $250 billion fix, they are now going to be expected to support health care reform as it's now proposed on Capitol Hill. Is that appropriate?
Well, that's the American Medical Association leaders here in Washington, who I think do not represent the doctors out there the way they should. Look, this is just another gimmick. They've said we'll have a deficit neutral bill. You're going to be at least $250 billion as of next year in debt over the next 10 years. The fact of the matter is that even the CBO, the Congressional Budget Office, admits that it doesn't know what the ultimate cost of this bill will really be. And secondly, they don't know what the effect on premiums will be. And the insurance industry says that premiums could go up 40% on top of that. And none of this is really factored into the cost of this bill. And there's a lot of this bill that just won't work very well. So I'm very concerned. Now, keep in mind, the Senate Finance Committee bill is probably the best you could get. And that's not going to be the final bill. They're going to more or less meld that with the Help Committee bill, which is a total partisan bill, and the Tri-Committee bill over in the House, which is also a total partisan bill. And there are all kinds of gimmicks, like not counting the first 3 or 4 years in order to keep this bill at $829 billion. You know, when you put it on a full 10-year track, the Senate Budget Committee says it will be $1.8 trillion. Then add the $250 billion more, you're over $2 trillion. And if you add the increase for cost of inflation, it's going to be even more than that. And I think we ought to really get serious about this and start worrying about how to make our healthcare system work better without all these costs, expenses, and payoffs to some of the Democratic people.
Senator, you mentioned both the Senate and House bills being sort of a one-party policy that's been put together, but there's been a lot of talk from the White House down about bipartisanship. However, Democrats have the numbers to put through to get whatever they would like to do as a group if they themselves could coalesce. Do you have any hopes of any bipartisanship injecting into any of these measures? What do you have in your arsenal at this point as a Republican?
Well, they're saying bipartisanship because they have one Republican senator who supported the Baucus bill out of committee, which is not going to be the final bill. But not only that, but they haven't worked with Republicans on either of the other two bills, and the final bill is going to be a lot worse than what the Baucus bill really is. Yeah, I think we could work this out if they were willing to really sit down and work with us to do it in a fiscally responsible way. But no, as a matter of fact, the Senate bill was what you call a conceptual bill, the Finance Committee bill. In other words, about 250 pages of what they hope it will be. When you get the final legislative language, it's going to be over 1,000 pages. And I hope that they'll give at least 72 hours for the public and all senators and congresspeople to review it. They may not even do that. So they're trying to rush this thing through so they can get basically to a single-payer system, in other words, socialized medicine, and have the government control everything in healthcare. The problem with that is that in Medicare alone, it's $38 trillion in unfunded liability, and that's the government plan for Medicare. Now, we ought to be fixing Medicare, and we ought to be getting our fiscal house in order, but this bill will make us completely out of order.
All right, Senator Orrin Hatch, we thank you, sir, for your time.
You bet.
Did he say 1.8 trillion?
Yeah, plus,
Did he say 1.8 trillion?
He said plus.
We're going to get